Health Plan Structure, HMO, EPO, PPO, POS, HSA, HRA. HMO, Health Maintenance Organization, is an organization that requires policyholders to select a primary care physician, PCP, and only then, receive treatment and care from physicians and specialists, within the established provider network. The PCP is responsible for coordinating the plan holder's treatment and care services. Plan holders must receive a referral for most specialist care services. Visiting a physician or specialist not designated by the PCP may result in paying all expenses out of pocket. An HMO plan is generally recommended for those who do not have pre-existing conditions that require a physician or specialist other than the appointed PCP. EPO, Exclusive Provider Organizations. An EPO is similar to an HMO, but with one key difference: a PCP does not need to be appointed. Instead, plan holders are bound to a network of physicians and specialists. Going outside the network results in higher out-of-pocket costs, but the plan holder is not bound by the recommendations of a PCP. PPO, Preferred Provider Organization. The PPO is nearly identical to the EPO. The only major difference pertains to out-of-pocket expenses that stem from visiting out-of-network payers. PPOs cover these visits at a higher rate than visits to in-network payers, whereas EPOs do not cover visits to out-of-network payers at all. If you require regular visits to physicians or specialists outside your plan's network, benefit the most from a PPO. POS, Point of Service Plans. A PCP must be appointed under a POS plan, and means you may only visit other physicians or specialists after receiving a referral from your physicians. You may also receive a referral from your PCP to visit doctors outside the established network. Out-of-pocket expenses are usually higher, but those who require regular visits to out-of-network physicians and specialists still receive some coverage. HSA, Health Savings Account. If you're insured under a plan with a high deductible, you may be able to open an HSA, an account used solely to save money that is used for future medical expenses. Monies distributed from an HSA used for medical expenses of the account holder or his/her dependents are non-taxable. Disbursed monies not used for medical expenses must be included as part of your gross income on your tax return and may be subject to an additional tax penalty of 20%. After the age of 65, account holders may withdraw all funds in the account with no tax penalty. HRA, Health Reimbursement Arrangements. The HRA is a savings account, used exclusively to generate funds for medical expenses. Unlike the HSA, an HRA must be purchased and maintained by an employer on your behalf. If and when HRA funds are disbursed, you are required to declare the amount on your tax return, as long as the money is used for medical expenses. The availability of an HRA is entirely up to the discretion of your employer.